So it's me again, Emilios. Thank you for your kind words again. My last talk and the last talk of the session. Acne management clinical update. See what's new. We all know what is acne is a chronic inflammatory disease. It's common in early adolescents, rare in pediatric and adults. Many different clinical presentation. Those are the clinical hallmarks of acne: non-inflammatory lesion, closed comedons, open comedons, an inflammatory lesion which consists of papules, pustules, and nodules. Its prolonged course may lead to scarring and cause significant disfigurement that severely impacts the patient's life with emotional sequelae, negative psychological impact, reduction of quality of life, negative social perception, and also body image disturbance. So the message is that we should start to treat acne as soon as possible in the best way. Those are the agents that are available: retinoids, antibiotics, antimicrobials, systemic agents like retinoids or antibiotics, hormones, other topical agents. Pharmacological treatment remain the main approach for almost of clinical type, but remember that its use may be associated with adverse reaction, side effect, which affect the patient compliance and decrease the adherence. So those are a list of the most common topical agents for acne. As you can see, all are associated independently if there are retinoids or BPO or antibiotics may still cause erythema, scarring, burning, flare, resistance, and photosensitivity. So in the last 5 years, there's been a lot of interest on cosmetics and cosmeceuticals play an important role in acne treatment, minimize common stratum corneal side effect from systemic topical retinoids, BPO antibiotics. If correctly prescribed and used, may have a synergistic effect with pharmacological agents. There is a lot of papers and articles in the literature confirming the efficacy of cosmetic and cosmeceuticals in acne. So this is our experience with the salicylic acid-based product for the treatment of mild comedonal papular acne, result from a recent multi-center prospective observational study. This is a new acne daily regimen, principally consisting of a cleansing gel, which is considered a cosmetic, with 2% salicylic acid, urea peroxide, and glycolic acid. Then we have a moisturizing gel in the morning, which is a cosmeceutical or medical device, better to define. Salicylic acid 2.5, nicotinamide, saccharide, isomerate, vitamin E. And then we have a purifying gel, again, another medical device to be used at bedtime, again, salicylic acid, zinc taurine, urea peroxide, vitamin E. 4 center, Ferrara, Milano, Naples, and Catania. Adult acne, mild inflammatory, comedon, and inflammatory acne. Washout period of at least 4 weeks for topicals and oral antibiotics. Wash out at least 3 months for oral isotretinoin. Material and methods: clinical assessment, so total lesion count, baseline after 4 and 8 weeks, investigator global best assessment at 8 weeks, instrumental evaluation with erythema directed digital photography, VCR, and then patient assessment for VAS, for patient discomfort, and tolerability, acceptability at 4-8 weeks. Patient 41, 28 female, 13 males, around 20 years of age, number of non-inflammatory, inflammatory lesions at baseline, blackheads, 16 plus or minus 16, papules around 8 plus or minus 4. At week 4 and 8, a significant reduction of non-inflammatory, inflammatory lesion compared to baseline was observed. Comedons, 16 at the baseline, medium range, 14 4 weeks, and 8, so half after 8 weeks. Papules 7.9, almost 8, versus 6.4 versus 4. Again, F of the papule count, also at 8 weeks with the statistical significant values. Overall assessment of clinical outcomes at weeks 8, EGA showed great improvement, 40% of cases, improvement in 26 of pairs of cases, mild in 20, worsening and unchanged in 10. Patient discomfort related to acne, significant reduction of VES, score at 4 and 8 compared to baseline, confirming that the patient of discomfort was minimal. The tolerability and acceptability at week 8 was 90% excellent, and acceptability was 97% excellent. Those are some cases at baseline. After 4 weeks, 8 weeks, we may probably better see it with Visia, with especially in the forehead, complete disappearance of the lesions. Another case after baseline, as you can see at 4 and 8 weeks, very interesting results. And another case at 0 after 4 weeks and 8 weeks. Again, you see that all the inflammatory lesions are gone and we have only residual post-inflammatory hyperpigmentation. So the mechanism of action of the main ingredients, the efficacy, in my opinion, is related to synergistic action of all active ingredients: salicylic acid, keratolytic, decrease inflammation; nicotinamide, sebum controlling, decrease inflammation; urea peroxide, antiseptic against P. acnes; glycolic acid as a keratolytic; zinc taurine, again anti-inflammatory; saccharide isomerate is a moisturizer. So all of these different compounds act on 3 of the pathogenetic factors of acne. Conclusion: the results indicate that this combination represents an interesting approach which undoubtedly deserves attention. When to use? Okay, this is the most important part. Mild inflammatory acne in patients that prefer to start with a non-aggressive treatment, in association with conventional therapy in patients with good tolerability as a maintenance treatment. So please keep in mind that it's not photosensitizing and may be used also during summertime. Thank you for your attention.